Are you someone facing itchy skin, rash, allergic reactions, which is somewhere called as dermatographism or urticaria or itchy skin with lesions that come and disappear? They come and disappear, but they don't tend to leave you at all since a long period of time. You take an antihistamine, which is right from a levocetirizine to a montecleucas to a bilastine to a Texin to a fexofenadine to any of these, which is given across the globe with temporary relief, but the problem comes back again. In this video, we're going to understand the root cause of the problem and how we make sure that we tell the patient that in spite of having the foods that you were allergic to, we see the allergies are gone and we see the urticaria does not come back again. Let's talk about urticaria and Ayurveda treatment in this particular video. Namaste everyone, welcome to Jyovis Hospital of Ayurveda and Aesthetic Center, Mumbai. Urticaria is an autoimmune problem. In Ayurveda, it is correlated to Shita Pitta. We see a lot of allergies. At times, urticaria is along with other allergic conditions, right from allergic sinusitis to allergic rhinitis to watery eyes to somewhere a lot of sneezing, allergic asthma. All these are the allergic conditions. As per Ayurveda, we work on the root cause, which is the Pitta imbalance or the Pitta predominance. From the modern point of view, we see all these disorders, they are divided into two ways. One is the allergy, one is the non-allergy. We understand this by seeing the investigations that patient often shares from their side. We see elevated levels of IgG and IgE in every single patient experiencing these allergies. Of course, if they are on a very heavy antihistamine to a high dose of steroid or an immunosuppressant, we may see the levels are lowered. But generally, even if these patients don't take the histamines or antihistamines or the steroids, the levels are high and patients tend to face a difficult time. The OPDs are full with patients of allergies and urticaria, and we see that over 6 to 8 minimum pills are consumed on a daily basis, where urticaria or these allergies are just managed for a few hours. So we need to understand Sankshepta Kriya Yoge Nidan Parivarjan. Nidan, we need to avoid it, we need to avoid the causes. At the same time, have a promising treatment like Ayurveda, which assures cure from the root cause for such allergic patients. So urticaria is so autoimmune that we see emotional stress can increase the problem, can be the major cause. A lot of people say that for so and so period of time I've had a lot of peanuts, lot of groundnuts. Although it being very healthy, we must know that foods that have histamines are known to cause allergies. So if you're a patient of any allergy, foods with histamines must be avoided, so you don't need an antihistamine, as simple as that. Anyone with emotional stress, anyone with histamine excess intake, anyone with excess of sour items, whether it's an orange or a lemon or some sour item like yogurt to pickle, Ayurveda it is said the sour will increase the cough, and kapha nasti kandu shot. There is no shot, there is no kandu, which is swelling and itching without the aggravation of cough. Cough goes high when you have sour. Cough goes high when you have sour. Sour will increase a lot of dryness and all. So we need to understand that no more cough. Very important. We see that these patients, when they increase their intake or regularize the consumption and excessive consumption of sour, they see patients experiencing itching. Even I share this with a lot of patients' parents that you have pickles in excess amount for 7 days and see whether you experience itching or not. Definitely these allergies tend to increase with excessive sour intake. So very important is to avoid the causative factors. Patients often ask, sir, I have a good lifestyle, I've done anything and everything that it takes to manage my condition, still I have urticaria. It is very important to know that if you have a good diet, your allergies won't increase. But that doesn't mean your allergies will go down. You need to reduce your pitta through the measures required to reduce the pitta. You need to have a shodhan karma, you need to have a pancha karma, wherein all the doshas, they are elevated through the lowered passage, through the lowered route, to the downward passage through the anus, which is the rechan of the pitta. Adhoga marga virechan is very, very important. So here it is said tatra dosharanam adhog margam virechanam. We need to alleviate the excessive pitta collected all in your koshta, from the shaka to the koshta and koshta out of the system. We need to have a pitta shamana dravyas. We need to have dravyas that consist trivrut. A common example is haridra khanda. So certain medicines we've explained in a lot of our videos by applying mustard oil, intake of haridra khand, some common dietary tips and general medications which has helped patients across the globe. It's very important to know that you need a proper treatment to reduce the pitta, which also reduces your IgG and IgE. A systemic changes in every 2.5 to 3 months in the investigation is seen in every single patient. Patient where they consume 6 tablets a day start coming to 4 to 3 tablets to 2 tablets every 15 to 30 days. Timely we see reduction in their dose, and again, once they come out from their antihistamine addiction or a habit, we see even if they stop Ayurvedic medicine, they do not go back to it again. Ayurveda is a science, world's oldest and the promising science, which has a beautiful result for Udar the Kot. It is correlated to Shot. It is correlated to Udarda, which is Udarda. It is correlated to Udarda and Kot in Ayurveda. So all these allergic conditions are beautifully reversed when it comes to Ayurveda. Choose Ayurveda, choose wisely, go through the videos and understand that by not just avoiding the cause, but also making sure the pitta is reduced through diet, which is consuming alkaline diet, to medications, to panchakarma, to rakta mokshan, letting the impure blood out. When we let the blood out, or when we let the impure part out, new part is formed in the body. So timely rakta mokshan, medication and dietary changes is very, very important. As per naturopathy and as per the dietary research, it is also said that ABC juice early in the morning, which is apple, beetroot and carrot juice early in the morning, has helped a lot of people. The research also says that foods that come in the gourd family in the form of a juice or a soup is very, very useful. Gourd, which comes from bottle gourd to ridge gourd to pointed gourd to ash gourd, consumption of all these gourd family vegetables help patient tremendously. Any doubts, any questions, we'd be happy to hear out from you. Until next time, from Jyovis and the team, look impressive, be progressive.